The muscle of the week is the levator scapulae. The levator scapulae originates from the C1 to C4 transverse processes and inserts on the superior part of the medial border of the scapula. It contributes to the elevation and the downward rotation of the scapula and assists in leg rotation. Stretching and strengthening the levator scapulae can help improve posture, reduce neck and shoulder tension, and prevent upper back pain or injury. You can stretch it with a seated levator scapulae stretch and standing wall stretch. To strengthen it, try scapular shrugs, prone Y raises, or resistant band rows. The levator scapulae is often linked to text neck, a condition that causes neck and shoulder pain as well as mobility issues. Poor posture and rounded shoulders can strain this muscle, especially in athletes and people who sit at desks for long periods. Regular stretching can relieve tension, improve posture, and prevent discomfort, making it a simple yet essential habit. The muscle of the week is the teres major. The teres major originates from the posterior aspect of the inferior angle of scapula and inserts on the intertubercular groove of the humerus. It is responsible for shoulder adduction and internal rotation and assists latissimus dorsi in shoulder extension. Since it attaches to the humerus alongside the latissimus dorsi and performs similar functions, the teres major is also engaged during lat-focused exercises such as closed grip lat pull-downs, cable pull-downs, and seated rows. It could be activated more effectively by internally rotating the humerus and pulling until the upper arm reaches a horizontal position instead of keeping the elbows close to the body. You can stretch your teres major as shown. It could be performed while standing or lying down. Isolated teres major injuries are rare, but they're more common among athletes, particularly baseball pitchers who frequently suffer shoulder injuries. Major League pitchers Corey Kluber and Clayton Kershaw have both missed games due to teres major tears. The muscle of the week is the rotator cuff. The rotator cuff is made up of four muscles: supraspinatus, infraspinatus, teres minor, and subscapularis. The supraspinatus originates from the supraspinous fossa and inserts in the greater tubercle. It assists in the first 15 degrees of shoulder abduction. The infraspinatus originates from the infraspinous fossa and inserts in the greater tubercle. It enables the shoulder external rotation. The teres minor originates from the lateral border of the scapula and inserts in the greater tubercle. It aids in external rotation and stability. Lastly, the subscapularis originates from the subscapular fossa and inserts in the lesser tubercle. It is responsible for internal rotation. To strengthen your rotator cuff, try exercises in the following three categories: shoulder rotation, shoulder elevation, and compound pushing and pulling exercises. Along with those, exercises for shoulder abduction strength, posterior shoulder strength, weight-bearing strength, and shoulder flexion range of motion improvement can help reduce shoulder pain. As the rotator cuff provides dynamic stability and contributes to multiple shoulder movements, these exercises can help improve shoulder strength, stability, and injury prevention. The muscle of the week is the deltoid. The anterior deltoid originates from the lateral third of the clavicle, the lateral deltoid from the lateral margin of the acromion, and the posterior deltoid from the crest of the scapular spine. All three parts insert on the deltoid tuberosity of the humerus. The anterior deltoid helps with shoulder flexion and can be strengthened with shoulder presses, front raises, and pike push-ups. The lateral deltoid is responsible for shoulder abduction and can be targeted with lateral raises using free weights or cables. The posterior deltoid assists in shoulder extension and can be strengthened with reverse flies, bent over lateral raises, and face pulls. You can stretch your anterior deltoid as shown, and lateral and posterior deltoids as shown. The deltoid determines the roundness and overall width of the shoulders, and if it's underdeveloped, the upper body may look narrower. So, deltoid exercises are essential for wide shoulders. The muscle of the week is the serratus anterior. The serratus anterior originates as 9 to 10 muscle slips from the outer surface of upper 8 or 9 ribs and inserts along the medial margin of the scapula. There's typically one more muscle slip than the number of ribs it arises from, as 2 slips often originate from the second rib. The serratus anterior protracts the scapula as an antagonist to the rhomboids and assists in the upper rotation of the scapula. To specifically target the serratus anterior, you can modify exercises like the cable crossover by avoiding full contraction. Instead, focus on moving the shoulder blades just enough to engage the muscle. Another option is to perform scapular protractions and retractions in a plank position. However, these movements are generally inefficient for muscle growth, so it's more effective to prioritize training the primary muscles and let the serratus anterior engage as a supporting muscle. Damage to the long thoracic nerve can lead to serratus anterior paralysis. When this happens, the muscle can't properly pull the scapula's medial border against the ribcage, causing the shoulder blade to lift away from the back. This results in a noticeable protrusion, making the scapula look like a wing, which is called winged scapula.